Myelopathy is rare, but very serious neurologic complication that can occur after CAR T cells and can lead to significant morbidity, and it requires prompt identification and intervention. It is rare. When we looked at the published case reports, there were 24 cases in total that were reported, cases of myelopathy, 20 in adult patients and 4 pediatric patients with lymphoma or lymphoblastic leukemia that had received CD19 or CD22 targeted CAR T cells. And these patients, most of the CAR T product in these patients contained the CD28 co-stimulatory domain, which is known for higher inflammatory response, higher CRS and ICANS, and all of the cases had experienced CRS and ICANS prior to the onset of myelopathy. And, they presented with different symptoms, paraplegia, quadriparesis, loss of sensation, bladder dysfunction, and so forth. And the management basically varied, but it included high doses of steroids, in some cases, IVIG, plasmapheresis, or tocilizumab, siltoximab, and anakinra. Of these 24 cases that have been reported, 6 of them died, but of those who survived, almost all of them remained in remission at the last time of follow-up, suggesting that the high doses of steroids that they had received for myelopathy did not compromise the efficacy of the CAR T cells. And you're questioning about management. So I think early diagnosis and intervention is key. As soon as, there are new or worsening neurologic symptoms, the recommendation is to do a prompt imaging evaluation with MRI of the brain and the spine, get neurologists and the infectious disease specialists involved, if feasible, to proceed with a lumbar puncture and CSF analysis. And this is not only to evaluate the opening pressure and for CSF diversion potentially, but also to look into other etiologies that could be there, such as infectious causes. The main treatment for myelopathy is steroids, high doses of steroids. Now, other supportive measures have been reported and seems to be also a valuable intervention, such as, IVIG or rehabilitation, physical therapy, occupational therapy, and in some cases, surgical interventions for CSF diversion.